Right. Hello, everyone. Welcome back to our DBT inspired skills training for helping clients with difficult situations. Thank you for being along for the ride for these couple of weeks. I am Dr. Green, a clinical and community psychologist, professor, and member of the MHTTC. So I wanted to kind of start the way we normally start with doing a partner share out and giving all of you a chance to talk about any homework that you did and experiences that you had over kind of the past week. So I want to do that, but first I just wanted to check in. Our last module, we don't have tons of time to answer questions, but I did just want to find out if anyone had like a burning question, something that you've really been worried about, something that you're very uncertain about or feels challenging that you wanted to just kind of bring into the space or drop into the chat. I can kind of spare a minute or a couple seconds for that. Anyone have any burning questions or wonderings, noticings? Okay, well, if you think about something or if something comes up, please drop it in the chat. Stephanie is monitoring the chat and kind of let us know that way. So I want to give you just kind of a bit of an overview what we're talking about today, and then we will kind of do the partner share out. We are, so let me share my screen. Right. So we are at the place where we are coming to kind of the fourth module in DBT, which is the interpersonal effectiveness skills. So we started off talking about mindfulness and the three states of mind, emotion mind, logical or reasonable mind, and wise mind. And we transitioned to talking about distress tolerance. And then last week we were talking about emotion regulation. And the reason that we went in this order is that mindfulness is really the foundation of all of the other skills. Mindfulness brings clients into the present. It allows them to practice having a non-judgmental stance, allows them to develop compassion for themselves and other people, and gives them the opportunity to connect with what their experience is internally and externally. And all of those pieces are going to be important as they try to implement the next set of skills. We went into distress tolerance because oftentimes when our clients are emotionally dysregulated or they're in situations that are out of their control, they might do things that might make situations worse or prolong situations, especially if they are not using skills effectively. And so the distress tolerance module is really about how can we help clients navigate situations that are out of their control that might feel distressing and overwhelming without making those situations worse. We transition to emotion regulation because emotion regulation really forms the foundation of healthy psychological well-being, healthy relationships, managing difficulties and stresses that come in life, and also managing your physical well-being. When we are emotionally dysregulated, it's actually hard to attend to our basic needs, for example. And so emotion regulation is really kind of the linchpin for many of these other skills. And so now we are extending the skills from kind of what's happening internally to what's happening externally. We are talking about how clients are showing up in their relationships, and we are looking at skillful ways of showing up and less skillful ways of showing up. And so interpersonal effectiveness skills are really about helping clients navigate relationships, moving towards meaningfulness, fulfillment, connection, moving away from disruption, abuse, conflict, and kind of misalignment in their relationships. And so our objectives today are to review the homework. I'm going to show you again the 5 options for responding to a problem, kind of our guiding framework, talk about the goals and objectives for relationships, introduce interpersonal effectiveness skills, and the personal bill of rights. So before we kind of jump into all of that, I would like us to spend some time talking to each other in partners or in pairs. And what I'd like you to think about or discuss is one skill that you tried so far on your clients. What felt challenging about using the skill? What felt less challenging? And one of the skills that you may have tried for yourself. So you can talk about a skill that you tried for your clients or a skill that you tried for yourself, what felt challenging or less challenging about using the skill. And so Stephanie is going to put y'all in partners and you'll have about 5 minutes. Okay, everyone, welcome back. I hope that you had an opportunity to talk to your partner about skills that you have either practiced for yourself or skills that you have taught to your clients, and a little bit about kind of how that went for you. I know that for me, when I was kind of first learning to teach DBT skills, they were much more straightforward on paper than they were when I translated them to working with clients. And that it just kind of took time to get a sense of the common challenges, the common barriers, and ways of modifying and also making the skills relatable so that clients are more likely to utilize them. All right. So I am showing you the problem-solving framework again, because for interpersonal effectiveness skills, we do want to think about solving the problem by being able to identify the actual problem, but we also want to think about what our goals and objectives are, right? Or have clients think about what their goals and objectives are when engaging in a interpersonal situation or communication. According to the Gottman Institute, which is one of the leading resources for couples research, about 69% of conflicts or disagreements within partnerships do not get resolved, which means the majority of the disagreements that pop up in partnerships don't have one solution. So if most of the time we are not asking clients to solve the problem in their relationships because maybe the problem can't be solved, then we really need to think about ways that clients are able to feel better about the problem, tolerate the problem, hopefully not stay miserable, and hopefully not make things worse. And so we can even think about the problem-solving framework in relationship to interpersonal effectiveness skills and how it kind of is tweaked a little bit. So I want you to just kind of think about, even with having some familiarity or no familiarity with interpersonal effectiveness skills for DBT, in what situation does DBT say that interpersonal effectiveness skills are not effective or not helpful? And you have a couple of options. So Stephanie's just going to kind of put up the poll. If a client is trying to get their child to follow a rule, is that a situation where DBT skills are not recommended? When the client wants to express a difficult and overwhelming emotion to a partner, when a client is experiencing abuse in a relationship, or when a client needs to apologize or take responsibility? Which of those situations are we not using DBT interpersonal effectiveness skills? Anyone else have ideas? We have about 50% of folks. All right, so most people are saying, okay, I think we have, okay. So most people are saying that when a client is experiencing abuse in a relationship is when DBT says, nope, that's actually not when to use interpersonal effectiveness skills. And you are correct. Before we go into thinking about skill use, we have to think about the quality of the relationships that our clients are in. And we have to encourage our clients to think about the quality of relationships that they're in, because the quality does matter in terms of how effective the skills are likely to be. In a relationship where a client is being harmed or abused, that actually is not the time where the client needs to practice better communication skills necessarily, but a time when we need to prioritize safety. Now, there are different circumstances where a client may not be able to readily leave a situation, right? Perhaps they are financially dependent upon their partner. Perhaps they live in an isolated place. Perhaps there are other reasons that they can't kind of disconnect from an abusive situation. And so as clinicians, as providers, not only are we paying attention to risk and safety, we also are paying attention to helping clients to survive and manage in those situations without making things worse for themselves. And so that might mean thinking about DBT and those skills a little bit differently. Because generally speaking, we encourage clients to use interpersonal effectiveness skills in situations where safety and risk are not kind of at the top of the priority list because they are safe. It's important to make decisions that support one's self-image, one's self-esteem, and self-worth. Sometimes our clients may feel as though, or may have learned that they need to sacrifice these things in order to preserve their relationships. And DBT says that you can have healthy relationships where you don't have to sacrifice your sense of self-respect and self-worth. You don't have to sacrifice all of your needs. You can be in partnership with someone else while also maintaining a relationship, a healthy relationship to yourself. So what's the problem? Many clients have learned ineffective or unhelpful ways of relating to other people. They may have trouble with relationships because they lack communication skills, they don't know what they want, or they have trouble controlling urges when they are emotionally dysregulated. Client relationship patterns may have been significantly impacted by past traumatic experiences. And so a client may be kind of reenacting some past relationship traumas in their current relationships. Clients may lack clarity regarding their goals and desires in interpersonal situations, and then they don't know what skills to use because they don't know kind of where they're going, what they want the results of those skills to be. They may have trouble identifying, setting, and maintaining boundaries in relationships. I've had clients talk about boundaries through the lens of punishment, right? Like, I'm going to set a boundary because I want to prove something to this other person. And when a client has that orientation towards boundaries in particular, it can be difficult for them to maintain their boundaries when they are not very upset about something, right? Or when they're not very hurt by something, when they are not feeling like they need to punish or kind of get back at someone else. And so it's important to help clients understand boundaries as protective of themselves, to help them understand boundaries as actually a mechanism that can facilitate a healthy relationship, a healthy partnership, a healthy friendship, a healthy family relationship, a healthy relationship with their kids. Really helping clients reframe some of the negative connotations that may have come with boundary setting for them. Clients may also feel challenged by the natural power dynamics in relationships. All relationships contain power dynamics, and successful relationships negotiate power well. And sometimes that means that there's one person who has the bulk of the power, another person, and sometimes another person who has the bulk of the power at other times. There are times when partner power can feel more collaborative, but really helping clients to understand that there are power dynamics, and it's important to be able to pay attention to those power dynamics, to call them out, and to modify them if they need to be modified. So what's the solution to those overarching problems? Helping clients to clarify their goals and to provide skills for meeting those goals. So we want to help clients increase their interpersonal effectiveness skills by because relationships and social support are really the foundation of psychological well-being. Having a healthy support system is a protective factor against psychological distress. It also makes it more likely that clients will have meaningful and fulfilling and connected lives. Interpersonal relationships often maintain and reinforce behaviors. And so when those relationships are, as the young people say, toxic or abusive or harmful, then those relationships can reinforce unwanted behaviors. When those relationships are nurturing and supportive, then those relationships can reinforce those kinds of behaviors. Interpersonal relationships are great places to practice emotion regulation because often that is where we are most triggered. And so they provide great opportunities for personal and emotional growth. Interpersonal relationships can also serve as corrective experiences for those who have had a history of harmful or traumatic relationships. When our clients are able to negotiate and create relationships that are meaningful, that are safe, that are supportive, that really can challenge some underlying ideas or beliefs about their ability to be loved, to be accepted, to be seen, and to be vulnerable and be safe in their vulnerability. Clients really gain a lot from better relationship skills, including having lower levels of stress overall. We also know that the quality of our relationships does actually significantly impact physical health. And so clients are also able to engage with their health better when they have supportive and helpful relationships. Effective communication skills can also improve work relationships. So the skills that we may be teaching clients to help them navigate their personal lives can translate to better, more effective professional lives. Research has also shown that healthy relationships have been defined specifically as having qualities of trust, satisfaction, love, intimacy, commitment, social support, and boundaries. I can't stress the boundary piece enough because for so many people, boundaries and healthy relationships don't necessarily exist together in practice. Maybe an idea, but not necessarily in practice. Many of our clients may have learned that love means no boundaries, right? Loving my kids means I don't have boundaries with them. Loving my partner means I don't have boundaries with them. Loving my mom means I don't have boundaries with her. Whereas boundaries are actually part of what helps a relationship to be healthy. And so often our clients come to us because of relationship stress, right? Difficult interpersonal dynamics. They may feel isolated, there may be high conflict, communication difficulties, and even confusion about appropriate boundaries. And so imparting interpersonal effectiveness skills can really go a long way towards increasing the quality of life for our clients. Interpersonal effectiveness skills have particular goals. You want to help clients use the skills to get their needs met from themselves and other people, to build healthy relationships and end destructive ones, to reduce confusion in relationships, to help clients engage in assertiveness training, to orient clients towards healthy boundaries, and also to help clients walk the middle path. I wanted to introduce the basic personal rights. And I wanted to introduce basic personal rights because effective interpersonal effectiveness skills doesn't only involve knowing about and respecting others, but it also means knowing about and respecting oneself. And so this list of basic personal rights can actually help clients to negotiate and understand when they might need to set a boundary, when they might need to communicate something. It can help validate and confirm their own experiences. It can also give them permission to engage in vulnerability and to make mistakes sometimes. So even things like I have the right to say no, I have the right to be treated with dignity and respect. I have the right to protest unfair treatment or criticism. I have the right to say, I don't know. I have the right to be angry at someone I love, that multiple things can exist at the same time. We can help our clients recognize that you can feel very angry with someone and also love them, that we don't have to sacrifice one for the other. And also that being angry with someone doesn't mean that you just get to do whatever you want to do because now you're angry with them. We can help them balance multiple things, that I can feel these very strong emotions and also have the priority of maintaining the relationship. So I don't want to do something out of anger or out of emotion mind that's going to disrupt their relationship, because that's something that is also important to me. I have the right to ask for help and emotional support. I have the right to negotiate for change. All of these rights can read really as a framework for clients to understand, how do I know whether or not I'm in a healthy relationship, right? How do I know whether or not I'm being healthy in a relationship? How do I know whether or not this issue is something I should bring up? These are all guidelines for answering those kinds of questions. Many of us, I like this quote by Bell Hooks because I think it really speaks to the importance of self-knowledge and comfort with oneself as a vehicle towards being able to actually have more effective interpersonal relationships. So what interrupts interpersonal effectiveness? Well, not having learned effective skills, not knowing what is wanted. Emotions can get in the way, right? When clients are too much in emotion mind, then they can't access skills. Forgetting long or short-term goals can get in the way. Other people can get in the way. So let's say your client is actually being quite skillful, that they're using their dear man and they're being gentle and they're acting interested and they're validating, they're showing empathy, they're doing all the things. And the person that they're talking to isn't having it, right? The person that they're talking to isn't interested. The person that they're talking to just wants to pay attention to conflict. The person that they're talking to is being ineffective. Other people can disrupt a client's use of effective skills. And so I often remind clients that interpersonal effectiveness skills are not about controlling the other person, right? We can't make another person understand our point of view. We can't make another person feel a particular way. We can't stop another person from feeling a particular way. Interpersonal effectiveness skills are about being able to manage one's own emotional experience within an interpersonal relationship and to navigate that experience in a way that doesn't make things worse, that preserves the relationship, that preserves self-respect, that also might make that person's needs known. Interpersonal effectiveness skills are not about the other person. Sometimes thoughts and beliefs also get in the way of effective interpersonal skills. And those thoughts and beliefs can be connected to emotion myths, for example, as well as relationship myths. We all have scripts that we are living out. And sometimes we're very aware of what those scripts are, and sometimes we're not. And those scripts extend beyond our thoughts about ourselves, but also extend to how we believe other people should be, how they should treat us, what they should know, what they should do, what they shouldn't do. And so these kinds of thoughts can also interrupt effective interpersonal effectiveness skills. Here are some relationship myths according to DBT, and this is a handout straight from the DBT workbook. So for example, myths that get in the way of objectives effectiveness, right? And so objectives are really when clients are setting their goals and objectives and they are using the dear man skill towards that end. I don't deserve to get what I want or need. If a client has this belief that they don't deserve to get what they want or need, they're not likely to make their needs or their wants known. If they say no, it will kill me, right? This idea that I can't possibly survive rejection. If someone rejects me, like it will just be devastating. It will annihilate me. If a client is very worried about that, then they are not likely to take the chance of asking for something that they need or want. I should be willing to sacrifice my own needs for others. I see a lot of women. I see a lot of women of color. I see a lot of women of color who have been socialized to believe that being a good daughter, being a good wife, being a good mother, being a good friend, being a good sister means always prioritizing the needs of other people over their own needs. And in doing that, they often don't realize what a toll it takes on them. And sometimes there's even pushback when I talk about things like paying attention to what their feelings are and noticing ways that they may be overextending themselves. Sometimes there's a pushback around, well, I mean, I don't want to be selfish. And so then we have to have a conversation about the definition of selfishness, what that really means, and who benefits in their lives from them kind of taking that stance, that the needs, the desires, the emotions, the well-being of other people is always higher than theirs. And that has especially been true when talking about family relationships. So oftentimes clients are not necessarily coming in and saying, well, I have these beliefs about relationships, and can you help me challenge them? You find these relationship myths by the ways in which clients are responding to learning the skills, the ways in which clients are showing up in their relationships with other people, the ways in which clients might even be showing up in their relationship with you. And so it can be helpful to just notice relationship patterns with clients, and also to give them this list, and so that they can begin to think about their own patterns themselves. And so myths in the way of relationship and self-respect effectiveness. So these are other goals. So one goal is to kind of get what you want, or at least make your needs known, set boundaries. That's the dear man skill. There are two other skills that we're going to talk about, give and fast, that are about maintaining the relationship and also maintaining self-respect. And so these are some of the myths that might get in the way of maintaining self-respect or maintaining the relationship. So I shouldn't have to ask or say no. They should know what I want and they should do it. And so I often have this conversation with clients about what they think other people should know about them, and how other people are supposed to know these things, and what it means if other people don't know these things, and how assuming that someone else should know something about you often prevents vulnerability. It prevents intimacy, because then you are not saying what you want. You are assuming that the other person knows and then becoming upset with them for not knowing. And so really helping clients to navigate and negotiate and understand why these beliefs are myths and how they actually work against what they want. So I shouldn't be fair, kind, courteous, or respectful if others are not so towards me. And so I think the young people say, you know, I return that person's energy, right? If they come at me with rudeness, then I match their rudeness. And so really thinking about how acting towards someone else in a way that might be outside of values or outside of alignment might actually work against who the client wants to be in the world, rather than working towards that. So again, just helping clients identify what beliefs might be myths for them, and how those myths are showing up, and how those myths can actually interrupt their ability to be effective in relationships. Power in relationships. There are three types of power balances that exist in relationships. Equal power, right? Power with. Two, you have or perceive yourself as having more power over your partner, right? I have power over. Or your partner has or perceives themselves as having more power over you. I am without power, power without, right? And here the terminology is with partner, but it's not just with partner. It's also with friendships, family relationships, even work relationships. And it's important to be able to help clients think about power in relationships, because power is always present, whether they are talking about it or not. And power imbalance often interrupts effective interpersonal relationships. And so calling power out and having clients be thoughtful about ways in which they negotiate or don't negotiate power, ways in which they might be aggressive or assertive or passive, and reasons why they might be aggressive or assertive or passive, can be very helpful. And to have these conversations not from a place of judgment, not from a place of morality, but rather from a place of effectiveness and values. Here are the skills at a high level. The dear man skill is used for the goal of asserting rights and wishes. The give skill is used for the goal of maintaining relationships. The fast skill is used for the goal of maintaining self-respect. Now, of course, most of the time, clients don't just have one goal, right? Or one objective. They may have many. So when talking to clients about identifying goals and objectives when it comes to interpersonal effectiveness, it's important to prioritize. And so thinking about, okay, I might want to assert my rights and wishes. And what's most important to me is to preserve the relationship. And so I'm going to use the dear man skill, but I'm going to use it along with give, right? So dear man is really kind of the foundational skill. It's kind of the what the clients do, and give and fast are kind of the how of the clients, of how the clients do dear man. So dear man is the what, give and fast is the how, and whether you use give or fast depends on what the goals are. So clients, though, before we get into whether or not they should use dear man or give or fast, we got to go back to the other conversation we were having earlier about what kind of relationship are we talking about. It's important when introducing skills to help clients think about the pros and cons of skill use. And when they are doing that, that's when you can ask the question, is this a healthy relationship? Is this a relationship that is worth maintaining? And DBT differentiates between destructive relationships and interfering relationships. A client can be in a relationship that doesn't feel very good to them or that is not very healthy without it being abusive, right? So destructive relationships, these are the relationships where there is active harm to self or others. Often it's physical, emotional, psychological, can even be sexual. And the properties of the relationship itself are also destroying the relationship, right? Interfering relationships, however, block the ability to pursue important goals or interests, maintain other relationships, or might disrupt a client's ability to enjoy their own life. So perhaps a client is in a relationship with someone who is not overtly abusive to them, right? Who might not be physically harmful or sexually harmful, but perhaps this person just doesn't really support them. So the client says, I didn't finish college. I had to leave school and kind of take care of my ailing parent. And I also ended up having a child unexpectedly. And so now it's 5 years later and I want to go back to school. And their partner is not supportive of that idea, right? Their partner says, well, you know what, like, I don't know the school's really for you, or I don't think you'd be good at that, or that's a stupid dream. They're saying things that might not be encouraging. They are doing things that might not be supportive, things that are not necessarily destructive, but things that are interfering. And so helping clients to distinguish between destructive relationships and interfering relationships can be really important when teaching them to use interpersonal effectiveness skills. And when it is time for clients to end relationships, it's really important to emphasize that they do so from wise mind, because relationships that end from emotion mind are less likely to stay ended, because there's often ambiguity that comes along when the emotions have turned down, when the person is no longer angry at a 10, when the person is no longer hurt at a 10, when they have thought about the other aspects of the relationship or the other aspects of the person, they're more likely to say, well, maybe, let's give this another try. Whereas when a person has had the opportunity to think clearly, as clearly as they can, taken time to consider their own values, really taken a step back, and they have perspective over their relationship, and they're able to make decisions from wise mind, those decisions are more likely to stick. Okay. And as I said earlier, DBT does not recommend using interpersonal effectiveness skills in the context of destructive or abusive relationships. And in those relationships, DBT suggests that safety planning is the priority. So if a relationship needs to end, DBT has an idea about how to help clients through that. Deciding to end the relationship in wise mind is really the first step. Using problem solving if there's any hope of retaining the relationship. That doesn't necessarily mean going back to the relationship. But for example, if a person is in an abusive or destructive relationship with the other parent of the child that they have in common, that person might want to, at some point, maintain a relationship with that other parent for the sake of the child. That might not be what happens right now, but that can factor into how that person is problem solving ending that relationship. use cope ahead to rehearse ending the relationship before it actually ends. Cope ahead is another skill from DBT, and the cope ahead skill is essentially anticipating a challenging or difficult situation, anticipating the emotions and the thoughts that might come up that will be difficult, allowing clients to imagine using their skills to navigate that situation successfully, allowing clients to really mentally rehearse the circumstance and the situation and rehearse it all the way through to a viable, a reasonable, and effective solution. And so cope ahead is a skill that can be very useful when clients know that they're going to go into a challenging or difficult situation. Then clients can use Dear Man and FAST skills, and I'll introduce what they are in a moment. And they can also use opposite action for love all the way if their relationship needs to end. So in emotion regulation skills, we talked about opposite action. Opposite action is a skill that is used when either the emotion that is present doesn't fit the facts, or the emotion does fit the facts, but acting on the emotion actually would be ineffective, right? Because the emotion, for example, its intensity is too high, or acting on the emotion doesn't actually lead one to the goals that they set. So a person is in a romantic relationship with someone, and the client has recognized, I really love this person. They know me very well. We have a great friendship in some ways, but in other ways, maybe the person is abusing substances and it's really just disruptive to the relationship. The person is not abusive to me, but they are destructive to themselves. And in them being destructive to themselves, they are also destructive to the relationship. That might be an interfering relationship, and an interfering relationship that then gets in the way of kind of me achieving and doing the things that I need to do in my life might be a relationship that needs to end. But maybe I really love this person, and the normal response with love is to move towards. The opposite is to move away. And so DBT says use opposite action all the way. So I actually don't see that person anymore, and maybe we don't talk on the phone, and maybe we don't really text, and maybe I have taken them off of my social media accounts so that we really are not in contact, because I am practicing opposite action of love all the way, because I know that I have to end this relationship. So I wanted to introduce Dear Man, and then we'll talk a little bit more about it. And so hopefully, I think this session, my screen share will work. We tried it. So let's see what happens.
Dear Man is an interpersonal skill set used when you'd like to ask someone for something in a way that will more likely get them to say yes. It's based on assertiveness training models and can be extremely effective depending on several factors. You may find as you listen that assertiveness like this doesn't fit with what you've learned from your family or your culture. That's okay. See if there's anything within this skill that could still work for you. The term Dear Man is a way to remember each skill: describe, express, assert, reinforce, stay mindful, appear confident, and negotiate. First, describe the current situation using just the facts. For example, you told me you would do the dishes last night, but this morning when I came downstairs, the dirty dishes were still there. This helps orient the person to exactly what you're reacting to. You might be tempted to say more like, "You're always annoying with this stuff." Don't do this. Keep your describe short, concise, and objective in order to grab the person's attention and avoid making them feel defensive. Next, express clearly how you feel or your opinion about the situation. Don't assume the person knows how you feel. For example, I felt disappointed when I saw the dishes weren't done. By sharing your personal reaction, you're helping the person understand why you're making the request. Next, assert your request by clearly asking for what you want. Don't assume the other person knows what you want. Be clear, concise, and specific. For example, can you please do the dishes now? Or, If you know you're not going to get to the dishes, can you tell me so that I can do them and we can have a clean sink in the morning? Notice how each assert was a question. It's not enough to simply express, I'd like you to do the dishes. It's also not effective to demand, do the dishes now. Asking an assertive question can be uncomfortable for people at first and may require a lot of practice. Finally, reinforce or reward the other person ahead of time by explaining what they could gain by giving you what you want. At a minimum, this can be expressing appreciation or gratitude, just by saying, I'd really appreciate it. Or try being more specific to the situation. Our living space would be cleaner, which would make me less stressed. I know I'm a lot easier to live with when I'm not so stressed. Now, the other person might interrupt you, argue with you, or try to change the subject. This is why it's important to use the skill of staying mindful of your goal in the situation. If needed, express your opinion or reassert your request again and again. It might feel silly, or you might be tempted to change up your script. Instead, just repeat in a calm voice, can you please do the dishes now? Or, I would still like you to do the dishes now. If the person responds with their own request, becomes mean, or tries to divert you, don't take the bait. Stay on topic and be mindful of your request. It also helps to appear confident with your voice and body posture. Convey that you know what you want and you're deserving of it too, while still respecting the other person. Don't whisper, stammer, or look down. Instead, speak up and stand tall. The skill is called appear confident, not be confident, for a reason. Fake it until you make it. Finally, negotiate if you need to. Be willing to give in order to get. This may involve reducing your request or offering another solution to the problem. For example, how about I unload the dishwasher first so you can empty the sink? Another way to negotiate is to turn the tables and ask the other person for solutions. What do you think we should do? I would like a clean sink in the morning, and you really seem to not want to do the dishes at night. How can we solve this problem? Dear man can also be used to say no to a request. Using the same steps, say no clearly. If someone asked you to hang out and you wanted to say no, a dear man response could look like this. Hey, I'm feeling pretty drained and tired. I can't hang out today. I'd be more fun on a different day when I have more energy. Can we hang out one day next week instead? Notice how describe wasn't necessary since the person already knew what you were reacting to. Notice how you asserted clearly, I can't hang out today, instead of saying something unclear like, I don't think I can today, or I'm not sure. Dear man is a skill that works best when practiced. Practice writing your dear man out ahead of time and rehearse in front of a mirror or another person. Describe, express, assert, reinforce, stay mindful, appear confident, and negotiate when necessary.
Right. So that is Dear Man with our little blue and green people. Dear Man skill is really kind of the cornerstone of interpersonal effectiveness skills for DBT. And in the handout, you all have that link, which could be really helpful also to show to clients so they can see what Dear Man can look and sound like in practice. And so this is just kind of an outline of what we just saw. The Dear Man is really about getting legitimate needs met, asking for one's opinion to be taken seriously, considering the cons of acting on emotions, and also saying no to unwanted requests and setting boundaries. And the technique that she talked about of saying the same thing over and over again, DBT calls that the broken record technique. And so the broken record technique allows the person who is using Dear Man to stay on task and to not become derailed. Negotiate. I always like to note with clients that negotiation is optional. The rest of the Dear Man skills are just a part of the framework. But there are some moments where we actually don't want to negotiate. So if we use the example that the video just used, I'm really tired and drained. I can't hang out today. I'd love to hang out on a different day. If that is the truth of where the client is at that moment, and going out or hanging out would actually feel burdensome, overwhelming, or more harmful to them, that is not a moment where negotiation is appropriate. It is actually appropriate to stick to what the person said in a way that is assertive and clear. And so I always say negotiation is optional. There's some situations where you actually don't want to negotiate. Implementing Dear Man can be challenging for a couple of reasons. Clients may have trouble identifying what their ask is. And so I like teaching clients the express request boundary framework, which I borrowed from Dr. Yana Abrams, who's another psychologist, who talks about ways in which we communicate in relationships, and we might think that we are communicating one thing when we're communicating another. So express, I talk to clients about express as telling a story. I came home today and the dishes weren't done. I haven't asked for anything. I haven't set any boundaries. I just told a story. I came home and the dishes weren't done. I came home, the dishes weren't done. I would love it if you could do the dishes before the end of the night. I made a request. I came home, the dishes weren't done. I would love it if you would clean the dishes by the end of the night. If we cannot agree on how we're going to do the dishes, then we have to sit down and talk about what the house rules are. Boundary. Sometimes clients think that they have requested something or set a boundary when really all they've done is express. And sometimes it is most appropriate to express. Sometimes it's most appropriate to request. Sometimes it's most appropriate to set a boundary. But it's helpful to have clients know the difference between these three and then be able to understand what it is they're wanting and which of these ways of communicating is more likely to lead them to the thing that they're wanting. Clients also may have been reinforced for not asserting their needs, right? Going back to the example I used earlier of many clients who think that prioritizing the needs of others is on par with being a good person, right? That's the definition of love, or that's the definition of being a good and dutiful brother, sister, lover, daughter, child. And so helping clients to recognize the ways in which messages may have been reinforced for them that are not necessarily that helpful. Clients may describe their feelings as facts, and they need to practice distinguishing the two. So remember, the D in Dear Man is just describe the facts. And so helping clients recognize that, yes, you may be feeling a certain way, but that's different than describing kind of just what happened. Clients may believe that the other person should know how they feel. And so they might use phrases like should. Why do I have to ask my roommate about cleaning the dishes? They should know that after they cook something, they should clean the dishes. Clients can also get caught in self-blame, which can prevent them from asking for what they need or want. They might negotiate when they don't want to, or when they're unable to, which is why I always tell clients it's optional. And sometimes clients associate boundary setting with punishment of the other person, or only think about boundary setting with conflict. And so considering these challenges, keeping these challenges in mind can help you as a provider be more successful in teaching clients to use Dear Man. I want to talk a little bit about assertiveness. Ideally, effective use of assertiveness skills allows their client to express their needs and wants in a way that is effective, but is not domineering or oppressive. And so when thinking about kinds of communication, we can think of assertive communication and assertive behavior, which is stating one's legitimate rights. It's about maintaining power within the relationship. Non-assertive or submissive behavior communication is power without, right? Like I am relinquishing my power. I don't have power. Someone or something else has power. Sometimes passive aggressive or so-called passive aggressive behaviors or behaviors that seem manipulative can be an expression of ways in which clients are feeling powerless. And so instead of directly confronting something or directly asking for something, they may do something that is indirect, that can sound like, look like manipulation, right? Or passive aggression, but often what that is, it is a way of trying to gain power when a person feels powerless. And aggressive behavior or aggressive communication is usually about power over. The give skill is the skill that is used for maintaining relationships, right? And so we're still thinking about the framework of Dear Man, but the give is how you are using Dear Man. And so G stands for be gentle. Approach the conversation with a sense of kindness and compassion. Hey, I know that you had a really long day and you've been really stressed. right? So no attacks or threats, no judgments, no sneering. And then act interested, right? Show interest in the perspective and the experience of the person that you're talking to. So I know you had a really hard week. Can you tell me just like a little bit about how you've been feeling when you come home? And then validate, right? You want to use words and actions to show that you're present in your understanding. I totally get how you would feel so exhausted coming home after like the long day that you have and kind of the job that you have. And use an easy manner. Man, like if we could afford someone to clean the dishes all the time, like I would be with it, right? An easy manner, sometimes use humor, be polite. This is about how you are ramping up, right? Or how you're teaching the client to ramp up to then talking about what they want, for example. So I've done all that. I've been gentle. I've acted interested. I've validated. I use an easy manner. And now I might say, so every night when I've come home, the dishes haven't been done. I feel really disappointed when that happens. Can you commit to cleaning the dishes before bed or right when you come home when you still might have a little bit of energy? I think it would be best for the whole house if those dishes are clean. Or maybe there's something else, some other way that we can think about doing this, right? So give is really trying to bring the other person on board before you are asking for what your needs are. Give can go wrong if the clients don't fully participate in the skill when they're not actually being gentle, but they're being condescending. Yeah, I mean, I know you have a hard job, don't we all, right? Or clients become derailed by arguing. So we get caught up on whose job is harder and who's more tired when they come home. Clients might be trying to maintain a relationship that's actually destructive to them. And so they're using give, but the relationship itself, right, has qualities that are already breaking down their relationship, as we talked about earlier. That's what a destructive relationship does. The qualities of their relationship are destroying it. And so give is not appropriate in a destructive relationship because one is not going to work against the other. Clients who are prone to ignoring or minimizing their needs may use the give skill to do so, where they're prioritizing the needs of another, and they kind of never get to dear man. And many clients may not have a lot of experience with validating. They may not have experience with being validated or validating another person. And so therapy can be really helpful here for being a lab for that. Fast is the skill that's useful and used when a client's priority is maintaining self-respect. And clients who are conflict avoidant or who fear abandonment may have a lot of trouble with the fast skill because they are used to blaming themselves and trying to avoid hurting somebody else at all costs. The fast skill begins with be fair to yourself and the other person. So you validate the other person's experience, but you also validate your own. I know that you have a really hard job, and you and I both, right, work 10-hour days. No apologies. It is important to apologize for the things that are the client's responsibility. I tell clients all the time, if it's yours, apologize for it. But if it's not yours, that's not your responsibility. That's not your place. So apologies are appropriate when a client is engaging in behaviors that are harmful to someone, but they're not appropriate when they're apologizing for having needs or being alive or making a request or having feelings or perspectives. S is sticking to values. Make sure that clients are clear on their values, especially the ones that are of great importance, and that they don't just give them up easily because they're afraid of conflict. And also being truthful, helping clients to recognize that being authentic, not lying in what they say or what they do, or even acting more helpless than they actually are, none of those things are helpful for maintaining self-respect. Barriers to implementing fast. Many clients have trouble identifying their needs, asserting them, and then not apologizing for it, right? I'm so sorry, but I need this thing. Is that okay? You may have to help clients define what self-respect means to them. How do they know when they feel respected? How do they respect themselves? How does it feel when they are being respected? It can also be important to help clients recognize when they're protecting themselves and they're protecting their self-respect versus when they might be the ones elevating elevating their needs over the needs of other people, because we don't want them to prioritize others over themselves all the time, or to prioritize themselves over others all the time. And the last skill is the middle path and the mindfulness of others. And so the skills here sound sound familiar: observe, describe, and participate. But now we're talking about utilizing mindfulness skills in relationship to other people. So fully attending to the other person, not multitasking, engaging in mindful listening, describing what's happening for them instead of judging, trying to avoid interpreting their experience, but instead listening to what their interpretations of their experiences are, and also not interpreting what you think they may or may not think of you, giving others the benefit of the doubt, and also participating, fully engaging with others, being a part of the interaction rather than trying to control the interaction. So I just wanted to end with this quote by Brené Brown. I define connection as the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, when they derive sustenance and strength from the relationship. And that can happen when people feel and are able to respect themselves, respect one another, when they're able to negotiate power successfully in relationships, when they're able to ask for what they want, for not apologizing for things that they don't have responsibility for, and when they're able to feel empowered, courageous, and confident. That ends our DBT inspired skill sessions. Thank you so much for being with us. I am a minute over time. I apologize. If you have any questions, please feel free to send those questions along, or any feedback. I know that there's been a lot of information. Hopefully, you'll be able to use at least one skill per module to improve your work and improve your clients' lives. Thank you for spending time with us. Take great care of yourselves and be well.